Hello, my name is Maura and I have decided to do my scenario project on anesthesiology. One thing that you must do a lot of in order to become an anesthesiologist is schooling. After high school, you will need to go through 4 years of college to get your bachelor's degree. Then you will need to do 4 years of medical school. Before graduating medical school, you must pass a test called the MSAT. Next is a 4-year-long residency, followed by an optional fellowship. Then you must get your state license, and you can choose to be ABA certified. After that, you will become an anesthesiologist. This is the average schedule of someone that attended the Cincinnati College of Medicine. Within the postgraduate year 1, your classes will be done at a university or medical center. The CA1 year is considered your first year of training and introduces the fundamentals of anesthesia. This is your first year of residency. Within this year, you will practice anesthesia on 400 to 500 patients. The CA2 year is similar to the CA1 year in the sense that you will be getting a lot of practice anesthetizing patients. Within the year, you are introduced to all types of anesthesia and how to deal with patients in pre-op. Another thing that anesthesiologists are required to do is report anesthesia time. This time begins the moment the anesthesiologist begins any preparation on the patient, whether this is in the operating room or in another area. Each 15-minute segment is reported as 1 unit of time. So if they are prepping them for 45 minutes, it is reported as 3 units of time. Accuracy is essential, so if you are with them for 63 minutes, it should be reported as 4.2 units of time. This does not include time looking over a patient's medical records. This is reported as a preoperative evaluation and is calculated in basic units. The time ends when the patient has been moved into the post-anesthetic care. Another thing anesthesiologists are required to do is calculate reimbursement. This is based off the time units that you calculated for anesthesia time, and the formula used depends on who has administered the anesthesia. Just like anesthesia time, accuracy is essential and you should not round up or down.
Equations. Equations are extremely important for anesthesiologists for many reasons. Not only do they tell you how much anesthesia to give, they can also help determine risk factors. The equations can change depending on the type of surgery, like respiratory and cardiac. Some equations that go along with respiratory surgery include ventricular and perfusion index ratio, time constant, and predicted PaO2 by H. Some cardiac equations include stroke work, oxygen delivery, where CaO2 means arterial content of oxygen, cardiac output, and cerebral perfusion pressure, where MAP stands for mean arterial pressure and ICP stands for intracranial pressure, and cardiac index, where BSA stands for body surface area.
Conversion charts and endotracheals. Endotracheals are another part of an anesthesiologist's job outside of anesthesia. They must determine the size for kids and the endotracheal's depth. Medicine is a big part of any doctor's job, especially an anesthesiologist. They must know how much to give and in what form is needed. These are some common drugs given before, during, or after surgery. They can either be given through an IV, which goes directly into the patient's bloodstream, or orally in the form of a pill. Along with solid drugs, they must also know the dosages for several gases like oxygen or nitrous oxide. These can be inhaled through a mask like most anesthesia is given, or they can be inhaled through tubes the way most oxygen is. Some fun facts of anesthesia include that people who smoke need more anesthesia than those who don't. This is because they have irritated airways. It has been shown that women who smoke need 33% more anesthesia during surgery than women exposed to secondhand smoke needing 20% more. Both smoking groups also needed a higher dosage of painkillers after surgery. This is because their irritated airways make breathing tubes more painful. Anesthesia doesn't necessarily mean you will be put to sleep. This is because there is 3 types of anesthesia: local anesthesia, regional anesthesia, and general anesthesia. Local anesthesia only numbs a small area of your body to prevent pain during a procedure like having a tooth removed or getting stitches for a deep cut. Regional anesthesia suppresses pain and movement in a large area of the body. This type leaves you fully conscious and able to talk. An example of this would be an epidural during childbirth. The third and most common form of anesthesia is general anesthesia. This type affects the entire body and makes you unconscious and unable to move. It is possible for a patient to wake up during surgery. While this is extremely rare, 1 or 2 in every 1,000 procedures involving general anesthesia result in a patient waking up during surgery. This is called anesthesia awareness. The patient becomes aware of their surroundings and events during the surgery. The awakenings are brief and patients do not usually feel pain. Anesthesia may affect your memory. It can cause memory loss for days or even months. Studies show that 37% of young adults and 41% of elderly patients report memory problems after going under general anesthesia. Some memory loss is due to the complications from surgery, and some are due to the side effects of anesthesia. The exposure to anesthesia can mask pre-existing memory problems in patients over 70. Anesthesia can be inhaled as a gas through a mask or injected into the patient's bloodstream. The average pay of an anesthesiologist is around $232,830, and the median pay is around $407,292. And finally, when undergoing anesthesia, you experience no dreams.